As an older person seeking medical advice to improve my quality of life, I rely on the expertise of healthcare providers for guidance. When I enter your office, I bring legitimate health concerns, expecting you to explore them with me and offer recommendations tailored to my needs. Unfortunately, this is not always the way older people experience healthcare in Canada or globally. Too often, older people encounter dismissive attitudes, assumptions about their abilities, or a reluctance to investigate their symptoms fully. For example, a woman in her 70s might be told her pain is just part of aging, or at your age, what do you expect? Or a man in his 70s may have his depression overlooked because he's older and lonely. Or a 90-year-old may be seeking rehabilitation after a stroke and may be denied treatment simply because of his age or her age. These experiences are not unique to one culture or country. They happen everywhere, from hospitals in North America to rural clinics in Africa, Asia, or Latin America. If the goal of healthcare providers is to improve patients' understanding, motivation, and self-management to enhance their quality of life, why do older patients often leave healthcare providers' offices feeling unheard or dismissed? What do you think is preventing you from achieving your healthcare goals of enhancing quality of life for your older patients? One of the major barriers based on extensive research is ageism. So why should ageism matter to healthcare providers? Well, the World Health Organization defines ageism as stereotypes, meaning how we think, prejudice, how we feel, and discrimination as how we act toward people based on age. And these biases are embedded in medical training, policies, and everyday interactions, often unconsciously. Studies have shown that ageist attitudes can lead to undertreatment or overtreatment of older patients, or can impact mental and physical health outcomes, can reduce access to essential care, including pain management and rehabilitation, and can decrease autonomy and dignity in decision-making. Ageism is not just an abstract concept. It has real, harmful consequences. In some cultures, older people are deeply respected, yet they may also face invisibility when it comes to receiving modern health care. For others, rapid urbanization and social change are eroding the traditional intergenerational support systems, leaving older persons vulnerable to neglect. In 2024, Ipsos survey revealed a significant gap in public awareness about ageism in Canada. And many older people themselves don't realize when they are being treated unfairly due to their age. But this is not just a Canadian issue, it's a global issue, affecting older people across different economic, cultural, and healthcare systems. So what can you, as a healthcare provider, do? Reducing ageism starts with awareness. Every healthcare provider must take an honest look at their own beliefs and behaviors toward older patients. Think about the way you speak to and engage with older people can help shape health outcomes, their sense of worth, and their access to appropriate care. As a healthcare provider, think about this. If you are fortunate, you too will grow older. So what kind of healthcare do you want for yourself in your future? This course is an opportunity to recognize and challenge ageist assumptions, ensuring that every patient, regardless of age, receives respectable, equitable, and high quality care.